The Iraqi National Stroke Program. This is the slide about this clay tablet that dates back to the old civilizations of Iraq. It's in the British Museum. It was in the 7th century before Christ, which claimed the differences between the Bell's palsy and stroke. This is Iraq. This is one slide. We are in the middle of the Middle East. This is Saudi Arabia, Iran, Turkey, and India, and this is Europe. So this is where our country lies. This is the burden of stroke. Unfortunately, in my country, we have a high burden of stroke, about 20,000 deaths. It claims to have a 14% of the total death, and we rank 31 among the whole country of the world. The country is, we have a 46 million population country, centrally directed health system based on the old social regime, and health system composed of public-private hospital as well as private clinic. Stroke service is covered mainly by public hospitals and private clinic. Health insurance is not widely applied through serious steps have been taken recently to endorse health insurance. Public hospitals are almost free, and health providers, mainly physicians and neurologists, good health service for most neurological disease, but not stroke. Indeed, we have good service for multiple sclerosis and epilepsy, but not stroke. In October 2023, a crucial meeting with the Minister of Health resulted in establishing two bodies: the Minister Committee for Stroke Treatment Development, which is a legislative power, and the Iraqi National Stroke Program, which is an executive tool for implementing plans to develop stroke treatment. Till this date, we did not have an organized, unfortunately, roadmap to organize the treatment of stroke in our country. So after this date, we started to establish the program from the very high key positions inside the Minister of Health. The medical treatment thrombolysis, a national system has been established. Acute ischemic stroke management protocol had been issued. There are 24 hospitals are being prepared to start the thrombolysis service, but only 10 centers are actively delivering the treatment at the time being. The number of cases are growing all over the country, and the thrombolysis is totally free of charge. More than 10 conferences done, as well as dozens of workshops and webinars. We have very good cooperation with Angels Initiative organization. You know, everybody that thrombolysis treatment is much more, it is the foundation for a good thrombectomy service. So we started with thrombolysis, and we have very good cooperation with the Angels Initiative. And when we established this system in the last year, we are now going to the next step of establishing an organized thrombectomy system inside the country. The thrombectomy service development, we have 10 thrombectomy centers in Iraq, 4 public and 6 private, 3 active centers in Kurdistan regions, all private. And this problem, more than about 100 cases of thrombectomy done mainly in the private sector. An official meeting held with the key officials and the Ministry of Health to start the Iraqi initiative for brain catheterization. And in this meeting, we put a roadmap to improve and organize the thrombectomy service in Iraq. You know, the next step, obstacles and solutions for thrombectomy. We have lots of obstacles, and I think that most of countries with the less resources have the same obstacles we have to establish the thrombectomy service. First of all, we lack of specialized human resources, interventionists and nurses. You know, we have only few people trained in interventional brain catheterizations, whether they are neurologists, neurosurgeons, or radiologists. And this is a main obstacles. An organized system of care specialized for brain catheterizations yet to be established, and the high cost of material used in cerebral catheterization. And this is the main obstacles toward the wide applications of brain catheterization, I think, in Iraq and outside Iraq. You know, the materials, the cost of brain catheterizations may be more than 3 or 4 times the cost of cardiac catheterizations. So in my country, there are maybe hundreds and thousands of cardiac catheterizations happen every year. We have more than 60 centers, qualified centers for cardiac catheterization, but still we have only 10 for brain catheterizations. And the three obstacles I've mentioned are the main obstacles, or one of the main obstacles. So in comparison with the cardiological service, we have very few resources for brain, and the high cost is one of the main causes. The absence of agencies or local offices for international companies inside Iraq. So we have to work with commercial intermediaries. And this is an obstacle. We don't have a direct connections with most of companies that deliver the treatment materials of thrombectomy. Lack of awareness among healthcare officials about stroke treatment, which led to less prioritizing the programs for stroke unless in comparison to the burden of the disease. You know, in most countries, you will have an established programs for cardiological treatment, cardiological interventions, for cancer treatment, even on for primary, secondary health issues, community like vaccinations, hypertension, and diabetes, and others. But for stroke, still the key officials in the Ministry of Health are not aware of the progress and of the development of the new treatment for stroke. So we held meeting with the officials to convince them about the importance of stroke treatment. You know, in my country, we have 43,000 cases of cancer, and we have 90,000, more than double the cases of stroke than the total cases of cancers. Yet we have multiple programs for cancer treatment and prevention and secondary and screening tests, but yet very few for stroke. And this is a major discrepancies in the stroke programs in my country, and I think in many other countries. Solutions: we have to advocating health officials the imperative of providing sustained support for stroke patients' treatment. We convince the Minister of Health, the main legislative powers in the Minister of Health, that there are new stroke treatment. Every dollar you invest in stroke treatment will yield $10 or more than $10 benefit. Okay. The training fellowships for our doctors and the staff, and this is a problem because we need to make a new generations of neurologists, neurosurgeons, or radiologists that are well trained in the brain interventions. We only have 10 qualified interventionists in my country in those centers. So there are a few numbers in regard to the total number of cases. And also access to cerebral catheterization materials with subsidized prices. You know, the prices of materials we think should be different from high-income countries to low or medium-income countries. And this is the main obstacles toward a progressive and well-established stroke thrombectomy service in moderately developed country. Adoptions and implementation of global standards and programs for stroke treatment. And this is easy with the cooperation with the Mission of Thrombectomy, as I said, even with other World Stroke organizations. We do well with Angels Initiative. We are doing very well with them, and we are a good service, but yet we need to have more cooperation with the Mission of Thrombectomy to have the same level of service. And encouraging international companies to establish a presence and reduce reliance in Iraq and reduce reliance on the intermediaries. And this is an obstacle because we all know that the main companies involved in this service, like the catheterization companies like Siemens and Philips and GE, and with the companies which supply us with the materials, let's say Penumbra or others, those companies are in really speaking, are the main, with the officials in the Minister of Health, are the main motive for establishing the whole system of care. So if you don't have an official representation of those companies in your country, that will mean that you will not going to progress. So I do think and believe and wish that Mission Thrombectomy in its situations will be a bridge between less developed countries and many other companies which supplies all those materials and infrastructure to help build the service in our country. This is our acute ischemic stroke management protocol version 1. It is INSP. It was issued in the Ministry of Health, and that's in this last year. And it's a 31 paper containing all the management plans that needed by any hospitals to start the treatment. This is the QR code of the same protocol. And this is our logo, the Iraqi National Stroke Program. And we thank you for your time.